Hello, my name is Angel Chin, and I'm an associate professor at the University of Michigan Rogel Cancer Center. And it is my pleasure to speak with you today about a topic that I'm very passionate about, which is biomarker testing in non-small cell lung cancer. When we think about non-small cell lung cancer and how it's evolved over the past several decades, it's really, really important to what we're talking about today because now we understand non-small cell lung cancer to be made up of several different groups of distinct cancers that are defined by certain biomarkers. And I'll explain what I mean. So traditionally and historically, we thought about lung cancer very simply as either non-small cell lung cancer or small cell lung cancer. Now, with advancements in technology, we then started understanding that non-small cell lung cancer had several different histologies, which means how the tissue looks like under the microscope. And we realized there were cancers called adenocarcinoma, squamous cell carcinoma, and other different types that all belong underneath this non-small cell lung cancer classification. But really in 2025 and beyond, we really think about non-small cell lung cancers being defined by a specific biomarker. So these are alterations in the DNA of the lung cancer, which really helps guide your oncologist in terms of how to best treat this cancer, as there now been many different targeted therapies that have been developed for these specific biomarkers. So first off, who should get biomarker testing in non-small cell lung cancer? And here it is really useful to refer to what we call the NCCN guidelines. So NCCN is the National Comprehensive Cancer Network, and they help put out guidelines for all different cancers in terms of helping to set the standard for what is considered best practice in treatment. So if we look at the NCCN guidelines for patients with advanced or metastatic disease, meaning stage 4 cancer, they state very clearly that for both adenocarcinoma and squamous cell carcinoma, that biomarker testing should be included. And this includes a variety of different genes which are listed, as well as something called PD-L1 testing. And we'll discuss all of this today in our talk. We will also talk about later how now biomarker testing is not just important in advanced or metastatic disease, but really for all of our patients who are diagnosed with non-small cell lung cancer, especially the adenocarcinoma subtype.